Hello and welcome to this quick demo of Business Analyst. Today, I would like to share with you some of the main capabilities that you will have access to using BA. Business Analyst is one of the most powerful tools we have for supporting hospitals and health-related services organizations. Basically, Business Analyst is the combination of a vast amount of socioeconomic and behavioral variables with the geoanalytical power of ArcGIS. Let me show you how easy it is to start using it. First of all, I will go ahead and add some data that I have in ArcGIS Enterprise. So I will add this web map here that you can see here in my web layers. And I will start using the locations for my offices, my office locations. So if I turn on this one, no, this is the layer, perfect. So what you're seeing here is my three main locations for my home health offices. The size of the circle is related to the number of employees I have in each of these offices. Perfect. So now I want to show you how you can pull socioeconomic data to understand a little bit more the context of these offices, the context of the community. So if I go ahead and create a color code map, I can access to all the data of Business Analyst. There is different kind of data sets here. I can access to population data, and you will see that it's not only the 2010 Census Bureau population information, but also we have projections for 2019 and 2024 made by our data team at S3. Even I am able to create my own population data. If I go ahead here to age, I can choose, for example, that I want to work with the projection of population for 2024. And maybe I am just interested in people that is 65 years old or plus 65 years. Maybe I'm just interested in females for this specific scenario, and I can save that variable. And it's super quick, and you can see how now I have access to that specific segment of population across this whole area. The reddish the census tract, the higher the number of people for this specific segment. Awesome. So let me show you now a specific scenario. What about if we want to map all the elderly people that have Medicare? So here what we will do is we will go ahead again to age. Instead of population, we'll go to age. Again, now we will select both people. What about 60 years onwards? We'll save this. There we go. And then we want to know not only where the elderly people is located, but also we want to see how many people have Medicare. So if I look for Medicare here in my database, there is a variable here in market potential that show me what is the projection of people that will have or that have Medicare for 2019. I can select this variable. And now what I will see, as you can see here, is not only the number of people, elderly people, that is represented by this palette of colors. So the darker the circle, the higher the number of elderly people in each census tract, but also I can see the representation of people that have Medicare. So that means that the bigger the circle, the higher the number of people that have Medicare. So those big circles that have also, a dark color could be my target. There is many elderly people here that are, that belongs to the Medicare program. So that was quick. I can see that for my three offices, can see here the 3 offices, the 3 green points here. I will zoom in to see these 3 specific offices. There is a high concentration of people that I could target here. Maybe I could open a new clinic, a new home health service here. So this is just a way to see this information. But what about if I want to use my own data? Or what about if I want to access, behavioral data? So let me show you another way that you can do that. If I go ahead to Create Maps and I select Smart Map Search, now what I will do is, again, I will select here, let me go ahead here, age, and maybe what I can do is go, and this is interesting because if you see here I have a segment called Favorites, and if I go ahead to Custom Variables, I already have selected the 65 years plus variable here as a favorite variable. So I don't need to create it again. I don't need to look for it. It's part of my favorite variables. Then again, I will select Medicare because it's important for me. There we go. But now I can also access to my own data. So if I go to my data, maybe I have access to the patient data. So in ArcGIS, in the platform, basically you can read information that is coming from your electronic health record or different other systems that you have in your hospital. You can take that data, you can aggregate that data as a census tract or census block level, and then you can basically take that data as a variable. So that's what we did. I will take this number of patients as a variable here. I will apply that, and basically what I am doing right now is I will start evaluating my target potential areas where we already have some market penetration. So if I go ahead here, let me select here. Let's say I want to see all those areas that have more than 30% of elderly people. Let's go to 25%. There we go. Then have Medicare, maybe at least 20% again. And then the number of patients in each of these census tracts should be more than 2. All right. So what we are doing here is a smart search. We are specifically filtering the information to see those specific targets, so we can have a better understanding of where we can laser focus our efforts. So this is really a cool functionality also. Now, the next question will be how we can basically do this kind of analysis at a scale. What about if we just don't want to, do a generic analysis, but we really want to compare 3 locations or 10 locations to see which of those locations is the most suitable or the best one in order to start a campaign or to add new services. So to do those kind of analysis, we have a tool called suitability analysis. If I go to suitability analysis, basically it will ask me for sites. Sites are basically not only the locations, but we need to create service areas in order to evaluate what are the, the socioeconomic characteristics of those specific service areas. So we will do that. I just need to go ahead here to my map layers. Here, this is my offices. So what I can do is set up a layer, specify that I want to create a service area based on driving time, set up the layer, and there we go. So what we have here is service areas. Any patient that falls within these service areas is at least 10 minutes away from my home health service. So now I can use that service area to basically create a suitability analysis. So if I go ahead here, let me turn this one layer here. Here we go. Okay, if I use those layers, what I can do is select these 3 service areas, go next, And now I can start adding my variables. Again, I will go to favorites, select my elderly people in the community. I can go ahead here to Medicare, select customer, no, market potential, Medicare, perfect. But also, what I want to add is data related to competitors. So there is something really cool in Business Analyst called business search. If I go ahead here in Gray Maps and select business and facility search, what I can do is search for specific businesses. Some of them are, well, all of them are basically based on the NAICS base code. So I can do a NAICS base code search. For those of you that don't know or don't have an idea of what the NAICS code is, it's basically the North American Industry Classification System. So say that you want to look for, say, home health services, there is a specific code that you can use for that. In this case is a 6216. If I enter this number here and basically look for all the home health services in the area, I can basically import those and start doing an evaluation of my competitors in my service area. Now, what I can do, which is really interesting, is I can save this layer, competitors, and then I can aggregate this layer and use it as one of the variables for my suitability analysis. And this is really powerful because if I go ahead here, let me go ahead here again, I will get rid of this. Give me a second, let me get rid of this. If I go ahead to suitability analysis, I had my two variables here. It's still are here. If I go to my data and select now the number of competitors, basically I just need to aggregate them and add them as a new variable in Business Analyst. If I apply that, then what I can do, or what I will see, is how the software will take all those variables and is creating an index. So we have the number of competitors, we have people that have Medicare, we want to see the percentage, and we have the percentage of people that is above 65 years old. One thing that we can do is defining what is the weighting of each of these variables. For example, the number of elderly people is key for my business, so that will have 50% of the weighting. My competitors are also a very key part of this analysis, so I will put 30%. However, the influence of competitors won't be positive, but inverse. And then Medicare automatically will be set to 20%. So you can see how now, after those modifications, the place that is the most suitable for a specific campaign where I have to be more aggressive. And since we want to know, how to really get that better penetration in this market, how we can really deal with the competitors in this market, it would be awesome to understand what is the reality of health organizations in this specific area. So what I can do is basically go ahead here, select infographics, and basically infographics are charts and statistics that are very key for decision making. If I select, for example, a different one, this one is called key facts, I can select the one that is called healthcare and insurance statistics, and I can see quickly what is the distribution of people that are having Medicare and different other programs that is 60 years old or plus or more than that, or how much people are spending in medical care, or how much people are spending in healthcare insurance, and different other statistics that definitely will help me to take decisions on how to better target this specific area. So this is just an example of some of the capabilities that you will have access in Business Analyst. Again, we have access to many geo enrichment and geoanalytic capabilities in Business Analyst. I hope you enjoyed this presentation, and if you have any questions, please feel free to reach out to us in the Health and Human Services team at Esri. Thank you.